Trauma Nursing by Christina Guzman, Paul Harvey, Emily DeCarli, and Sarah Perroque.
A trauma nurse is a licensed medical professional who specializes in emergency care and cares for patients with life-threatening injuries. They are also known as critical care nurses or ICU nurses. They typically work in emergency care units, trauma centers, and transport units. Emergency transport nurses provide care to patients who are being transported to healthcare facilities, and flight nurses typically work on medical transport aircraft transporting patients to healthcare facilities.
Most common trauma injuries and scene cases. The top four are motor vehicle crash, unhelmeted motorcycle or bike accident, assault, and fall. Motor vehicle crash due to driving intoxicated, speeding, and distracted driving are the most common cases. With these accidents, bone fractures, compound fractures, multiple break injuries are what commonly occur. Those who are older do have a higher fatality risk and a longer recovery period. Unhelmeted accidents, you'll more than likely always see some sort of head injury, bone fracture or break, as well as spinal injuries that could lead to potential paralysis. Assault. Assault victims often come in with head and facial injuries and traumas, as well as internal bleeding that can leave the patient in critical condition. And lastly, falling. Most fall accidents result in hip fractures, head trauma, and multiple bone breaks. The elderly community is the most at risk for serious fall injuries.
Trauma nurses specialize in treating patients who have had a traumatic injury and work to help stabilize the patient. Once the patient is stabilized, and if no other trauma patients need attention, a trauma nurse may rotate through the emergency department and assist there, depending on the hospital's policies. While many ED patients are facing life-threatening illnesses, they're not often suffering from a traumatic bodily injury. Some organizations require trauma nurses to have taken a Trauma Nursing Core Course, or TNCC, which provides specialized skills for those working in a trauma unit. In environments or organizations where ED nurses and trauma nurses are treated as two different specialties, it's sometimes helpful for a new nurse to gain experience in the ED before pursuing specialization in trauma. The experience with triage and working with pediatric or orthopedic patients can be helpful when you become a trauma nurse. Due to the nature of traumatic injuries, many trauma cases will involve the bony structures of the body to include fractures and breaks, so being comfortable with those types of injuries is important to a trauma nurse's success. According to statistics from a 2016 study by the California Department of Public Health, it shows that it's important to be familiar and comfortable in a very wide range of injuries and specialties in order to be a successful trauma nurse.
Specialty trauma centers. Listed here are both Adult Trauma Center and Pediatric Trauma Center. Statistics show that going to a trauma center best for you or your injury type has more of a positive patient outcome than not doing so. At specialized trauma centers, they're more equipped and trained for those specific needs rather than the general needs. And as for transport time, no matter the situation, there's always going to be a goal for a fast transport to provide adequate patient care. Pros versus cons. I found there to be more pros than cons, but the cons that I did find were serious toll-taking ones that really need to be considered. Some of the pros I found were rewarding work, a wide variety of tasks, always something new or different, it's teamwork oriented, and you're always on your toes. So at the end of the day, this is always going to be rewarding work, whether it feels like it or not. You are the positive light in the situation that your patient is currently in. You'll also have new and incoming patients constantly with different traumas, giving you a wide variety of work, always on your toes for the next step with that patient or a new incoming patient. And trauma is also very teamwork oriented, so you'll have more than one brain working, and you'll always have someone to lean on or help you with or brainstorm with you. And some of the cons that I found were it can be an emotional toll, it's high stress, and you're always moving at a rapid pace. So the emotional toll is Losing a patient isn't easy. Decompressing is something that most and/or all nurses need to do, especially in a trauma center that can be a little more difficult at times. Stress is always going to be in your nursing career, but moving patient to patient can cause high stress, and it can play a huge role in the rapid burnout rate.
The nursing field is experiencing rapid growth. Due to the length of most nursing programs and the fact that most programs across the state are impacted, meaning that there are on average more applicants than spots available in any given program, nurses are in high demand and short supply. Another factor contributing to this rapid growth is the fact that the average age of an RN is well over 50, meaning that in the next 15 to 20 years, a very large portion of our current nurse force will be approaching retirement. According to a study performed by California, the projected job market growth for an RN is expected to reach about 16%, which in terms of job openings is just about 200,000 new positions created on top of vacancies already left open by career changes, retirement, or other reasons. The demand is evident as many organizations in densely populated areas frequently have recruitment programs looking for qualified nurses in good standing. In regards to salary, the average annual salary of an RN in California in 2019 was about $106,000, or roughly $51 an hour. But you also have to consider where you want to work as an RN, as rural locations often yield a lower salary.
Among the many important qualities that a nurse must possess, trauma nurses are required to have emotional stability. It is important that a nurse can maintain focus while dealing with stressful situations such as pain, suffering, and death. Other important qualities include, but are not limited to, flexibility, commitment to patient advocacy, empathy, attention to detail, interpersonal skills, compassion, critical thinking skills, and attentiveness.
In the healthcare system, nurses historically are shown to have the highest rates of burnout. A study was done to evaluate the levels of burnout at a level 1 trauma center. This anonymous cross-sectional online survey asked 126 trauma staff nurses a series of questions based on Maslach's Burnout Toolkit, or MBI. This is a reputable method of measuring the chances someone is experiencing burnout and to what extent. The nurse's main concern was the number of patients per nurse. In emergency departments, the law states that there may not be more than 4 patients per 1 nurse. 4 or more made the job overwhelming. The nurses with 4 to 9 years of experience showed more emotional exhaustion and depersonalization, which is used to calculate burnout. This shows us that nurses with more tenure have higher chances of burnout. Risk factors that were found that correlate to exhaustion were an existing mental health diagnosis and working with adult populations in trauma. Another risk factor is overall health issues that are additive stressors. Correlations for less burnout were also found. A support system such as family, personal achievement, and good relationships with coworkers proved to help alleviate stress at work. Solutions include addressing nurses' concerns such as creating more efficient work schedule plans, as well as easy electronic charting that can help accommodate for time. Team building exercises are also being implemented by supervisors and managers so that nurses feel a sense of community and have a system where they may ask for help if need be. This was a photo that went viral. It is the inside of an emergency room after medical professionals tried to save a patient. What is evident to non-medical professionals and medical professionals alike is the effort and chaos that is involved when assessing and treating a trauma patient. As a trauma nurse, you must have the strong innate desire to help people to the point where you have done everything you possibly can to help save a patient's life. At the same time, this nurse must be able to compartmentalize their emotions and let them go after a successful and unsuccessful patient case. Trauma nurses are in demand. They are needed in rural and urban areas alike. Education is never ending because lives are unpredictable and they must be as much informed as possible. A prime example is the current pandemic that is affecting ER nurses worldwide. These are our first responders in times of crisis. The job is rewarding, exhausting, and respectable for good reason. I myself am humbled by this photo and hope that our presentation gave you an idea of what it means to be a trauma nurse. Thank you for watching and listening.